Hey everyone, and welcome. I'm Dr. Wada. I'm an allergist immunologist, but more importantly, I'm a fellow patient navigating the unpredictable world of autoimmune disease and something else we're going to talk about today, which is dysautonomia. Today, we are diving deep into a connection that many doctors miss, in part because it doesn't get taught, and this is the link between Sjogren's disease and dysautonomia. If you have Sjogren's and you're dealing with dizziness, fainting, digestive issues, or feeling like your body's thermostat is completely broken, this video could be life-changing for you. Or the reverse, maybe you're dealing with all those symptoms and you wonder what could be driving them. I'm speaking today both from the professional and the personal experiences here. I have both Sjogren's disease and dysautonomia. And for years, I dealt with symptoms that seemed completely unrelated to what was going on in my heart or in my body. I had racing heart when I stood up. I got dizzy if I stood still for too long. I had to make sure I was super hydrated. Lots of digestive issues, which I'll try not to share too many of the details there, and temperature intolerance. And I was living with it while also seeing my patients. I've seen countless Sjogren's patients being told that their dizziness is just dehydration, their digestive problems are just IBS, their fatigue and body pain is just fibromyalgia. And I've been there myself. But what if I told you there often is a much more specific explanation, and more importantly, there are treatments that can help? The reality is that dysautonomia, or the dysfunction or misfiring of our automatic nervous system, affects a significant number of people with Sjogren's disease. It's not a separate condition you develop. It's often a direct result of the same autoimmune inflammatory processes that are affecting the other parts of your body. So let me explain what's really happening in your body and why understanding this connection can really transform our approach to treatment. So what is dysautonomia? It's quite a mouthful, right? Your body's control system has gone haywire. So I want you to think of your automatic or autonomic nervous system as your body's autopilot. It controls all the things you don't have to think about: your heart rate, your blood pressure, digestion, temperature regulation, how much you sweat, if your pupils are dilating or constricted. And your autonomic nervous system has two main branches: sympathetic, which is your fight or flight response, and your parasympathetic, which is your rest and digest response. And these symptoms work together in a bit of a choreographed dance. They're constantly adjusting to keep your body ideally functioning pretty smoothly. But in dysautonomia, this dance becomes pretty chaotic. It's like the two partners are out of sync. So in Sjogren's disease, we're not just dealing with dry eyes and dry mouth. The same autoimmune process that affects our salivary and tear glands can also affect our nerves that control our autonomic functions. It's like having a computer virus that doesn't just affect one program, it affects the entire operating system. And this is why so many Sjogren's patients experience symptoms that seem completely unrelated to their dryness disease. Your body's telling you that this condition goes far beyond just dryness. And interestingly, at times, the dryness can be driven by this neurologic dysfunction too. I know this firsthand when my own symptoms started related to blood pressure and getting dizzy when I changed positions. I couldn't really understand why or how all of this was together, right? Why would my Sjogren's, which is just causing dry eyes and dry mouth, be affecting my heart rate or my digestion or my ability to regulate my body's temperature? So what is this connection between Sjogren's and dysautonomia, and why does this happen? Here's what's fascinating about the research. The autonomic problems in Sjogren's often don't correlate with how severe your dryness or glandular symptoms are. You might have relatively mild dry eyes and mouth, but significant neurologic problems or autonomic dysfunction, or vice versa. And this tells us something really important. This is not just about gland destruction. Your immune system is producing autoantibodies that can directly target autonomic nerve fibers and receptors. Specifically, antibodies targeting muscarinic M3 receptors can affect both glandular function and autonomic regulation. But these aren't particular things that we can easily test for in the clinic, right? It's not a test that I can just click a box and send blood work to check for these. I also want you to think of it in another way. Your immune system has created proteins, antibody proteins that are like keys. They're opening the wrong locks throughout your body. And they're not just affecting your tear or saliva production, they're also interfering with the nerve signals that control your heart rate, your blood pressure, digestion, and temperature regulation. And this is why dysautonomia and Sjogren's can sometimes respond to immunomodulatory therapy, so things that turn down inflammation. We're not just treating symptoms, we're potentially addressing the underlying autoimmune and autoinflammatory process that's driving this whole show. So it's really important that we recognize dysautonomia symptoms in Sjogren's. And when we know what to look for in the questions to ask, gosh, you see it a whole lot more often. So let me walk you through some of the most common ways that dysautonomia shows up in Sjogren's patients. Many of you are going to recognize these symptoms, but you might not have realized that they're all connected. And I certainly didn't realize this connection when I was experiencing them myself. So number one is orthostatic issues. So these are symptoms that occur when you change position, especially if you're going from laying down to standing up. Orthostatic intolerance is one of the most common manifestations. This is what I deal with. And this includes lightheadedness or dizziness when standing up, heart palpitations or racing heart when you stand up, feeling faint or actually fainting, needing to sit or lie down frequently, and feeling worse in hot weather or after hot showers when your blood vessels expand and blood can pool. Some patients will develop a more severe or in a slightly different version of this called orthostatic hypotension. This happens more often in different neurologic conditions, but this is where your blood pressure drops significantly when you stand and it doesn't budge much. Others will develop something called postural tachycardia syndrome, POTS. And this is where that heart rate is incorporated in the diagnostic criteria. So you have blood pressure issues and issues where your heart rate is out of whack, for lack of a better explanation. And that requires a jump by 30 beats per minute when you go from laying down or sitting to standing. Gastrointestinal dysautonomia. It is more than just the dry mouth that makes it hard to chew and swallow. Digestive function is heavily controlled by your autonomic nervous system. So GI symptoms are incredibly common. Gastroparesis, or slow emptying of the stomach, can lead you to feel full very early, nauseous, bloated, chronic constipation, intestines aren't moving things along properly, alternating diarrhea and constipation, the things that look and feel and often are given the diagnosis of irritable bowel syndrome. Severe bloating, especially after meals, nausea that's worse in the morning or with position changes. Next on the list, temperature and problems with sweating. Your body's thermostat is controlled by your autonomic nervous system. So if you feel really awful in hot weather or heated environments, you have heat intolerance. If you are excessively sweating or you can't sweat anymore, again, these are red flags. And temperature dysregulation. I remember a period of time prior to my diagnosis where I just could not get warm. I was bundled under blankets. Now, granted, I live in the Midwest. It was a cooler time of the year, but I had sweaters. I felt like nothing could get me warm enough. And I thought perhaps maybe I had a thyroid issue, but my thyroid got checked and that was fine. It was really bizarre. But when you feel really cold, when others are comfortable, eat real easily, this is a sign of temperature dysregulation. Bladder and urinary issues, urgency, gotta go. Frequency, gotta go to the bathroom all the time, which may also happen if you're hydrating because you have dry mouth or you have low blood pressure. So that can be a little bit of a challenge to tease out. Inability to fully empty your bladder or having trouble where you're losing urine when you don't want to. So incontinence, either from some of the bladder spasms often that can result from autonomic dysfunction. I think one of the most profound and sometimes hardest to treat symptoms is the overwhelming fatigue. It's not just being tired. It is this bone deep exhaustion that doesn't improve with rest. When your autonomic nervous system isn't working properly, your body has to work so much harder to maintain its basic functions. If you are reading this list and thinking, that's me, you're not alone. These symptoms cluster together in Sjogren's patients so much more frequently than the general population. So how do you get your dysautonomia diagnosed? In a perfect world, we use specialized testing that many doctors aren't super familiar with, especially outside of a neurologist's office or a cardiologist's office. So there are certain test modalities that are available that really do test autonomic function quite well. Tilt table test. It's gold standard for diagnosing orthostatic intolerance in POTS. You're strapped to a table. It tilts you from laying flat to standing upright while monitoring your heart rate, blood pressure. Sometimes they'll also do blood draws to check different hormone levels during that testing as well. Heart rate variability testing. This measures how well your autonomic nervous system is controlling your heart rate. I actually do this on a regular basis with my Oura ring. It tracks my HRV, and I can see how different conditions, like if I had a poor night of sleep, or if I decided to have a glass of wine the night before, if I worked out, how these things affect my heart rate variability. And I know when that level is higher, that my autonomic nervous system is functioning at a bit better level than a day when it's lower. It's interesting to see how that tracks across my cycle too. Sweat testing. So this is often called a Q-SART, essentially special stickers with receptors and are put on the skin. And this assesses the body's ability to regulate temperature through sweating. And this is a test that is pretty good for small fiber neuropathy. Gastrointestinal motility studies. These often are called gastric emptying studies. There also are a few other studies along these lines that can check motility in other parts of the gastrointestinal tract. But these can show if your digestive system is moving food along properly, or if that emptying is occurring more quickly or more slowly than what's considered normal. So what can you do at home? One, you can check orthostatic vital signs. It's important to, if you're going to do this with someone who can partner with you, and you want to make sure that you are in a place, in a space where if you do have significant drop in your blood pressure and potentially pass out, that you're not getting injured. We do not want any head injuries or concussions from doing this at home. Make sure you are talking about this with your personal medical team. Although I'm a doctor, I'm not your doctor in this context through YouTube. So that is my disclaimer. But you can measure your heart rate and your blood pressure while lying down. And then again, after you stand up, and then immediately after stand up, and then after you've been standing for several minutes. And significant changes can suggest orthostatic issues. And that can give you some more data to bring to your appointment with your healthcare professional that is guiding your treatment. Symptom tracking, super helpful. I really like using health wearables as long as you're not getting super ultra focused and obsessive about it, super helpful as well. And I think it's critical to find the right team to help take care of you, the right physician who understands both Sjogren's and dysautonomia. This might be a rheumatologist with autonomic expertise. My good friend, Dr. Brittany Panico, is totally on board with that. A neurologist specializing in autonomic disorders, cardiologist who specializes in POTS, a gastroenterologist who knows all this, like our good friend, Dr. Zach Spiritos, the occasional allergist immunologist who has interest and a real focus on our practice. That would be me. Don't be discouraged if your first doctor that you see doesn't understand this connection. This stuff still is not being taught in medical schools. This is really things that are newer in our understanding of chronic multisystem disorders. And the great folks at Sjogren's Foundation and Dysautonomia International and other similar organizations are doing their best to reach out to train physicians in understanding this and to help them build better toolbox. But it just takes a lot more time than we would like to do that. So those are all the things to really help explain this connection between Sjogren's and dysautonomia. I want you to make sure to hit the subscribe, because my next video, I'm going to talk all about what we can do about this. What are some treatment strategies to really take an approach that's really holistic, a multimodal approach when we think about addressing the symptoms related to Sjogren's and the underlying autoimmune and dysautonomia processes. So we're going to really talk about a comprehensive toolkit. So make sure you hit subscribe so you don't miss it. If you hit the bell, it will send you a notification when it's live next week. In the meantime, I want you to know that having dysautonomia, having Sjogren's does not mean you cannot live a full, active life. It does mean you have to be smarter about how you manage your body and how you advocate for appropriate care. As someone who's living with both conditions, I can tell you that understanding this connection and getting proper treatment has made a world of difference in my quality of life. The key to understanding this isn't separate from your Sjogren's. It's part of the same disease process. And when you treat it more comprehensively, addressing both the autoimmune component and the symptomatic management, so many patients see significant improvement. I've experienced this improvement myself, and I have seen it in countless of my patients as well. So in the meantime, some practical tips for daily life. Plan your day around your energy patterns. I am a morning person. I try to do that most thought-intensive work of my day during that time. Stay ahead of your symptoms. Don't wait until you're feeling awful to implement your management strategies and to pull those tools out of your toolbox. Educate your support system about these connections. Share this video with them. Say, hey, I want you to watch this video series, Dr. Wada, so that you can better understand my lived experience and what the heck is going on with my body. And connect with others who understand both Sjogren's and dysautonomia. You're not alone. Come join our Facebook group. I'll have the link below. We discuss these complex manifestations of autoimmune disease. You'll find others who understand the frustration of having symptoms dismissed, having experienced medical gaslighting, and the relief of finally getting some answers too. If you're in one of my licensed states, you can come see me as a patient. If you're not, I do medical mentoring education sessions. I just want you to remember your symptoms are real. They're connected. They're treatable. Don't let anyone tell you that dizziness, digestive issues, and fatigue are just part of Sjogren's, or the contrary, that they're not related at all, without exploring whether dysautonomia might be playing a role in your constellation of symptoms. You really deserve comprehensive care that addresses all aspects of your condition. So keep advocating for yourself, keep learning, and know that better days are possible with the right approach. I want to know, what are your questions about dysautonomia, about Sjogren's? Help me know what kind of content you want to hear. If you've experienced these connections in your own health journey, share your experiences in the comments below. Your story might help someone else realize that they're not alone. And again, remember, hit the subscribe and the bell so you can see part 2. We're going to talk all about treatment. And until then, take care and be well.